It can be hard to talk to teens about sex and birth control, but a pediatrician or family doctor can help get that conversation started. And here with some advice, our favorite pediatrician, Dr. Stephanie Hansen, is here to, help get the conversation started. That's a great way to say it, really, because there's so many difficult conversations, especially with teenagers. Yes. But why is it important to talk about birth control?
Right. I always say our work as parents is never done.
Right. It's true.
These conversations are ongoing. They're not a one and done. And this is just one of the many hard topics that it's important to talk about with your kids. Studies show us that about 50% of high schoolers are sexually active, which puts them at risk for things like sexually transmitted infections and pregnancy. And both of those things can be pretty devastating to a teen. They can cause long-term mental health issues, long-term health issues, and long-term financial issues. So just like we want our kids to be protected by wearing a seatbelt in the car and wearing a helmet on their bike, we need to talk to them about using birth control if they're sexually active.
We don't want our kids to have sex, but just because we don't want it to happen doesn't mean we can avoid the conversation as well. So how important is it to start that conversation, to talk about not only sex, but then birth control options?
Yeah, well, I think, first and foremost, you want to make sure that your child understands your family values, and really talking about how abstinence is the main way that someone can prevent pregnancy and sexually transmitted diseases. So you can lay that right out there from the front. But I think it's important for kids, even those who are not sexually active, both boys and girls, to understand how birth control works, what options are available, how they can access it, and to let them know that you're a supportive parent and that you want them to be safe and healthy.
Yeah, you don't want them to be scared to ask you a question,
right.
Especially when it's as important as this one. Mm-hmm. So there are some other reasons, though, that you might want to have your child on birth control.
Right. We think about contraception as one of the main reasons for using birth control, but it can also be helpful for acne. It can help manage heavy or painful periods. Some patients require hormone therapy as a mood stabilizer. So there are many different reasons why someone might use hormonal medications.
Okay, yeah. Very important reasons right there as well. Okay, so what are some of the things that parents should consider when they're talking about some of the different options?
Yeah, well, I think first of all, parents need to be educated and understand what's available. That's a great question for your child's doctor, but there are some really nice resources available through the CDC that can help walk you through those options and to kind of understand, because things have changed over the past many years.
I was just thinking that as you were talking, like so many things. I think, I was a teenage girl at one point, but my goodness, all of the different things that were the go-to have changed so much, and things that I don't even know if they're all still used.
Well, I think it depends a little bit about what your goals are as well. Is cost a consideration? Is your child reliable to take a medication every day, or is it better to have something that they don't really have to interact with? Are they afraid of needles or procedures? Do they know how to swallow pills? So just, thinking about that, and the good news is there's options for everyone.
Yeah, can you expand on that? Because I was thinking, everybody's just like, well, the pill. There's so much more than just the pill. And going through, there was the ring, the patch, and now, different when you're talking about things being implanted. So pediatricians and family medicine doctors now actually recommend long-acting reversible contraceptives for teens. So those are things like IUDs, which are implanted into the uterus and are good from anywhere from 3 to 10 years, or implants that go in the skin in the arm, and that's good for 3 years. Both of those are incredibly effective forms of contraception, and it's kind of a set it and forget it method, which is great for a busy teen who may not always remember to take a pill. Wow, very good. I didn't even realize that. I didn't realize that was kind of on the radar for teenagers. Let's talk a little bit about things that you said don't have to be inserted then.
Yeah, so there are injections that you get every 3 months. There are skin patches that you apply to the skin and don't have to take a pill. There are vaginal rings that are inserted by the teen into their vagina. And then I wouldn't forget either, for males, making sure they understand how to access condoms and how to use condoms properly.
Don't forget about the boys.
Right.
Do kids need to, have parents' permission to have these conversations? Or
it really depends on the state. And I think it's important to set the stage early on that you're a supportive parent, that you are there to help them navigate these challenges. I think it's also important for your child to have private time with their healthcare provider when they go for their checkup, so that they can ask those uncomfortable questions and get guidance that way as well. But state law varies, so you should just know the landscape of where you live and what your teen is able to access.
Okay, great conversation. Thank you for the tips for parents on how to get started. Dr. Hansen, thanks for coming in. Stay with us. Coming up next, we are checking in with the AARP fraud fighters to help protect you from a travel scam.